On the Saturday AM edition of Newsfeed. If you've just joined us, good morning. I'm Mthokozisi. Now, health professionals have been warned to be vigilant of malaria symptoms as they exhibit the same as those of COVID-19. It comes as special attention is currently being paid to COVID-19 whilst malaria care and control declines. As we gear up for the holiday season, it will be crucial for travellers to be extra cautious when travelling this year. But how best can travellers educate themselves about COVID-19 and malaria? Dr. Mthokozisi Sibanda, the director at African Applied Chemicals, joins me now for more. Dr. Sibanda, a very good morning to you. Thank you so much for your time. I suppose during an unprecedented time such as the COVID-19 pandemic, the distinction between the different viruses is always one that one should pay attention to. Malaria and COVID-19 are said to have more or less the same symptoms. What are the big differences when it comes to the two?
Well, I mean, malaria, unfortunately, they have the same symptoms with COVID-19. And I think the safest thing will be that you get tested so that, it's quickly isolated whether it's malaria or it's COVID-19. I think to use small differences between the symptoms might actually cause more harm than good. So the best thing is, if you feel the symptoms, just go and test and get a scientific opinion on whether you have COVID-19 or malaria.
When it comes to malaria, it's endemic to 14 of the 16 Southern African countries, with the exception of Lesotho and the Seychelles. But the distinction of malaria in these 14 countries is extremely varied. What makes them stand out?
Well, I mean, it always depends on climate. If you look at Lesotho, is high up there in the mountains, so the temperatures tend to be very low and they do not support the existence of mosquitoes. But in general, sub-Saharan Africa has a mosquito problem. And in South Africa, at least the Department of Health has managed to keep it under control, but it's still existing in Limpopo, Mpumalanga, and KwaZulu-Natal, the regions that are near the border between South Africa and Mozambique. So from that part going into the interior of Africa, the whole of sub-Saharan Africa, you expect to be under risk of getting malaria infection.
We're also learning that, Gauteng has a substantial number of malaria deaths, especially for a province where malaria is not endemic. What may some of the reasons be for that, discovery?
Well, okay, so the most important thing is right now during the holiday season, people are traveling and they tend to go into these malaria areas, get migrant laborers going back to their home countries, which, have very high cases of malaria, such as Mozambique. So as people, come back, they bring the parasite into Gauteng. And when they get sick, usually the source of the parasite will be traced back to where they would have been, and in this case, they would have gone into those malaria areas. So what's very important really is to tell people who are traveling into those areas to take basic precautions to prevent themselves from being infected with malaria. We expect that malaria control, by the government has declined due to the lockdown. So we expect numbers of mosquitoes that carry malaria to increase. And science tells us that mosquitoes, have evolved. They know that if you are in a house, you are most probably going to die because there is one method of killing mosquitoes that is in use. So they tend to bite people outdoors. And malaria-carrying mosquitoes tend to bite people exclusively on the ankles and feet whilst outdoors. So it's very important to pass this message to people who are traveling into malaria endemic areas and people who are in those areas to ensure that they protect their lower limb and ankles from effective mosquito bites. And one of those you can buy if you are going to go hiking, an insect or mosquito repellent hiking sock, or you can wear a band around your ankles that emits a slow release formulation of an insect repellent. And that will reduce the probability of being bitten by malaria-carrying mosquitoes and reduce your chances of getting malaria, particularly during this season.
There are only specified species of mosquitoes which are malaria carrying. Perhaps it's important to be able to perhaps clarify the distinctions here of how the malaria carrying mosquitoes work and how they end up in one's body stream.
Well, I mean, to simplify that, we basically divide them into two. You get nuisance mosquitoes, the ones that you find up here in Gauteng that bite people and all over. Those cause a nuisance, but they don't transmit malaria. And then you have these special species, such as the Anopheles arabiensis, which carry the malaria parasite, or have the ability to carry the malaria parasite. And, you tend to find those in those border provinces with Mozambique and the rest of sub-Saharan Africa. And for some reason, they can't survive in Gauteng and the rest of the country. But once you get to those border regions, that's the perfect climate for them. So the only precaution that you can take is when you're in those areas, that you're in the company of malaria-carrying mosquitoes. And it's very important to be aware of the precautions that you need to take.
Dr. Sibanda, I know at the very beginning of our conversation, you said that, it's best for one to take a COVID-19 test should they suspect that they have the symptoms of either COVID-19 and malaria. But can you give us a breakdown of the processes once you get bitten by a malaria-carrying mosquito, how you begin to feel throughout that period?
Well, I mean, the paras goes when the mosquito, we infect mosquitoes with malaria, and they in turn reinfect us. So when a mosquito bites you and it's already infected with the parasite itself, it transmits that parasite into your body and it begins to quickly replicate inside your bloodstream. And the main symptom is headache, a very strong headache, fever, periods of high temperature and periods of low temperature, lethargy, and all those things. So if you start to feel that you're not feeling well, you've got headaches, a slight fever and all that, it's very important to quickly go to a medical center, do the tests that are required. It's fairly easy to test for malaria. It's fairly easy also again to test for COVID-19. So you can quickly isolate whatever is affecting you, and you quickly get onto treatment. But I think the main thing is this fever and headaches and pain in the joints. That's the telltale signs of malaria.
When it comes to COVID-19, of course, we're now being informed and we're dealing with the second wave of the pandemic. But there's also been concerns as we are into the festive season with interprovincial travels and super spreaders and all the terms that we're now learning of. What do you think, one should be superly cautious of as they travel and, have the ability to be able to distinguish that they are feeling some sort of symptoms that need to be urgently attended to, whether it's malaria or COVID-19?
Well, we all know that with COVID-19, we don't fully understand it. But there's enough data to estimate or tell how you can protect yourself, social distancing, wearing masks and all that. So it's kind of difficult right now, especially if you go into a malaria endemic area and you have such a contagious disease as COVID-19 and such a contagious disease as malaria, for you to really tell the difference between the two. So, the bottom line is, if you're not feeling well, you don't have to second guess what it is. Just let the experts tell you what it is and get you onto a proper treatment.
Very lastly, you say a contagious disease such as malaria. How exactly is it spread?
Well, it's spread through mosquito bites. What happens is that mosquito bites a person, remember, mosquitoes need protein to grow their eggs, and they get that protein from blood, particularly human blood. So they then bite. If they bite a person who has got malaria, they ingest the blood. That's how they get infected with malaria themselves. Now, unfortunately, they don't get sick, but they have the ability to grow that parasite within their body. And then when they feed again for their next blood meal, that's how they get to bite the next person. So it's very important to understand the disease transmission characteristics of malaria and also of COVID-19, and take precautions between the two to ensure that you limit the risk of getting infected by both.
Very well. Thank you so much for your time. The Director of African Applied Chemical, Dr. Mthokozisi Sibanda, giving us a sense there of the distinctions between malaria and the second wave of the pandemic.